Good morning, and welcome to TPMG's webinar for how to become a certified lean healthcare professional. Before we get started, a little bit of an introduction. That's me in the picture to the right with my team of green belts and black belts at Shanghai United Healthcare in China. My name is Gerald Taylor, and I'm one of the Performance Management Group's Lean Six Sigma Master Black Belts. And yes, I'm a proud Sun Devil. The business school at Arizona State University is kind of like the mob. Once you get out, they just pull you back in. But it's a great place to learn about global business, where I studied international business at the graduate level and quantitative business analysis at the undergraduate level. I've been a master black belt since 2001 and have been consulting in the healthcare industry for a little bit more than 12 years. But please forgive the hyperbole. I'm not trying to brag. I just want to provide you with my qualifications up front to establish some credibility and to assure you that this will be a productive use of your time. We're going to invest the next 45 to 50 minutes to provide you with a course preview of our Lean Six Sigma Excellence in Healthcare Delivery Black Belt and Green Belt certification programs. To that end, I will introduce to you our consulting firm, TPMG, share some of our analysis of the healthcare industry. I'll then provide you with a briefing on what Lean Six Sigma means to the healthcare industry and how it works. Finally, I'll provide you with an overview of the course content for both the Black Belt and Green Belt certification programs. And then I'll close with some pricing information. Afterwards, I'll be delighted to answer any questions you may have. So who is the Performance Management Group? We are a group of closely held Lean Six Sigma Black Belts and Master Black Belts with one mission: helping our clients become more productive, efficient, and cost-effective. Our services are highly specialized, from Lean Six Sigma training and consulting to performance analytics and process transformation with robotic process automation, machine learning, and artificial intelligence. Here's a punch list of some of our healthcare clients. Since 2011, we provided Lean Six Sigma training and certification consulting services to clinics, hospitals, and systems in North America and all around the globe. So why has Lean Six Sigma been so popular and useful in the healthcare industry? The method is primarily used to address a problem that's been plaguing the healthcare industry for some time, which is a lack of productivity. Our research has revealed over the past 20 years, healthcare has experienced only marginal gains in labor productivity at best. In fact, from 2001 through 2007, productivity in healthcare has declined at an annual rate of 1.5%. And from 2007 all the way through 2017, there was only a slight increase. What makes the healthcare industry so peculiar is, over these same time periods, there have been significant gains in quality. Unlike most industries, those improvements have not been reflected in productivity gains. And there's a price that we're all paying for this lack of healthcare productivity. In fact, currently, the US healthcare expenditures are approximately $4.3 trillion, which is greater than the economies of Germany, India, the United Kingdom, and France. And because of a lack of labor productivity, provider costs rise 3 times faster than inflation rates. Labor cost alone represents about 56% of healthcare industry delivery costs. And since 2002, labor costs has been putting a major squeeze on operating expenses and operating margins. How does Lean Six Sigma help in this situation? The object of the Lean Six Sigma method in healthcare means improving patient outcomes while reducing the cost of care over the entire care delivery cycle. This is done by black belts and green belts, enhancing the clinical, operational, administrative, and cultural functions of a healthcare delivery systems. But to illustrate this notion, I've prepared a quick 3-minute clip of how lean transformation actually works in healthcare.
And over to the right, oh, I'm sorry, over to the right side.
63-year-old Robert Sherrill had no idea lower back pain could hurt so much.
Like, wow, what's that? And it was tremendously weakening, and it took me right down.
Any problem with that?
Sherrill is among the 80% of all Americans who will have a bad back sometime in their lives. And when that happens, many patients undergo an MRI, an expensive imaging test. But 9 leading doctor specialty groups recently said MRIs are often a waste of money and medically unnecessary.
All the way down.
Doctors here at the Virginia Mason Medical Center in Seattle take that to heart.
Good.
They use special software at the lower back pain clinic that rejects any order for an MRI unless a long list of criteria has been met.
If there is no evidence-based indication, the test cannot be ordered.
Virginia Mason's Dr. Robert Mecklenburg says in just 3 years, they've eliminated unnecessary procedures and saved money.
And we've seen well over 10,000 patients in this clinic. Their return to work is twice as fast as the old style of back pain care that we delivered before. Their patient satisfaction is much, much higher. The cost of delivering the care is much less.
The software is part of the medical center's war on waste that started more than 10 years ago. At the time, the center was losing money, and Dr. Gary Kaplan had just been named CEO.
Waste is all of those things which add no value for the customer. It's embarrassing, frankly, but we find most processes, 70 to 95% of the time that's spent adds no value for the customer. The waste of waiting, the waste of movement, the waste of over-processing, the waste of excessive inventory, all wastes that add no value.
The prestigious Institute of Medicine recently zeroed in on waste. It said $750 billion is wasted every year in the American healthcare system.
Great to see everyone this morning.
Kaplan and his staff first got the idea for doing these sorts of changes when they started visiting Toyota in Japan back in 2002. They were convinced that some of the big car makers' philosophy would work in Seattle, but it was a hard sell to the staff of 5,000.
I would say in the beginning we maybe had 10% early adopters, really champions of this work, and then there were 10% that I sometimes say over my dead body, I'm not going there, and then 80% in the middle.
At Virginia Mason, every employee is expected to report any serious concern they may have.
May I come in?
It's helped reduce liability costs by 60% since 2004. It's also led to better patient care. The hospital's nursing staff has been part of the change. Charlene Tachibana is Senior Vice President and Hospital Administrator.
We really started looking at where nurses were spending their time, and we found that they weren't spending it with patients.
In fact, they were spending too much time collecting supplies and drugs ordered for patients by the staff. So supplies were removed from a central storage room and put into hospital rooms bedside.
Through a variety of changes, we wound up taking our nurses' time from 35% in direct contact with patients to upwards of 90%.
The case for change is compelling. The resistance to change and the anchoring in the status quo is still very strong. And so that's our objective here. We talk at Virginia Mason about transforming healthcare, and some might say, well, it's delusions of grandeur. And really all we really want to do is show what's possible.
So the question becomes, how quickly did Virginia Mason generate material or significant results? In the first 2 years, they saved $1 million for an additional hyperbaric chamber that was no longer needed because of improved efficiencies. In addition, they saved an additional $1 to $3 million for an endoscopy suite that they no longer needed because they became more productive. And they avoided $6 million for new surgery suites that they found no longer to be necessary. In addition, budgets allocated to inventory went down by 53%, and additional productivity improvements redeployed 158 employees to open positions, helping the system return the allocated hard dollar savings back to the equity of the organization. When potential black belts are asked why they seek Lean Six Sigma certification, they often cite an interest to build their credentials and skill sets. They want to get paid more, and they want to grow their professional network and would like to be recognized as an expert among Lean Six Sigma practitioners. And our program of studies are built around these 4 attributes. As a quick FYI, we pulled some information from Glassdoor, and currently in the healthcare industry, Lean Six Sigma black belts are actually demanding and receiving total compensation packages upwards of $160,000 per year. The Lean Six Sigma black belts are still in high demand, and they're still very much appreciated. Okay, so let's move forward. Our certification programs have been certifying professionals in the healthcare industry since 2011. They provide for a quality principles overview, in-depth instruction in data analysis or management by fact, and we give you a structured performance improvement methodology called the DMAIC methodology that's used by Lean Six Sigma black belts and master black belts around the globe. In addition, a playbook for improving the patient experience and HCAHPS ratings has been recently integrated into our black belt certification program. Our programs of study are well respected because they're derived from 4 industry respected bodies of knowledge. The American Society of Quality's Lean Six Sigma body of knowledge, the Healthcare Criteria for Performance Excellence from the Malcolm Baldrige National Quality Awards, iSixSigma.com's bodies of knowledge, and the Project Management Institute's body of knowledge. As a Category B education source, our programs qualify for the Project Management Institute's professional development units. Candidates receive 60 PDUs for Greenbelt certification and 100 PDUs, professional development units, for Black Belt certification. And upon completion, candidates also earn continuing education units, and we'll talk a little bit more about that down the line here. Here is a brochure of the course content for the Greenbelt certification program. We start out by discussing the background and history of Lean and Six Sigma. We call it the roots of Lean Six Sigma. And then immediately we bring you into how to analyze operational performance using KPIs and metrics charted on the REN chart with some specific rules, statistically based rules for measuring performance. Give you a crash course indeed about how to design a process. We'll walk you through SIPOC process mapping, and then we walk you through how to build and create and analyze a cross-functional flowchart. Okay. In the Greenbelt program, we'll take you through an extensive techniques for measuring the voice of the patient. You will receive the analytical toolkit that all Lean Six Sigma Green Belts and Black Belts walk through. We have a very rigorous program of statistical process control, not just for service organizations, but for healthcare organizations in particular. We'll walk you through team dynamics, how to put together a team and manage a team successfully, and the roles and responsibilities of each team player. Then we'll teach you data collection planning and data collection methods. And then we introduce to you the DMAIC approach. This is the improvement science associated with Lean and Six Sigma. We've separated out an entire unit to do a real deep dive in Lean transformation and Lean fundamentals in a healthcare organization. We separated out the Baldrige Healthcare Criterion for Performance Excellence. We've done that for one specific reason. We think that all Green Belts and Black Belts should understand, by going into an organization, what are the strengths and weaknesses of the performance of that organization. And there's nothing like the criteria for performance excellence that will give you the qualification in order to do that. And so we've integrated that into the program. Now, the Black Belt certification program is even more robust, where the American Society of Quality's Black Belt certification body of knowledge is built primarily for manufacturing. Our Black Belt certification course content has been adapted to make it more fitting to a healthcare environment. We've removed sections such as response surface methodologies, designed experiments, Monte Carlo simulations, and we've replaced them with activity-based costing, the balanced scorecard, the playbook for improving HCAP scores in the patient's experience, and a variety of other things. Now, in order to become certified as a green belt, each candidate must complete the intensive online bootcamp certification training. You must successfully complete the TPMG Lean Six Sigma Green Belt certification exam. And as a candidate, you're going to deep dive into the 5 stages of the Lean Six Sigma performance improvement method. So we've got some deep dive assignments built in and woven into the program to enable you to really build some skills and some competencies. For the Green Belt certification program, no certification project is required, but it is optional. So if you choose to have a sort of certification project, then we will allocate a Master Black Belt to you to provide you with the proper coaching to ensure that you build the right skills and competencies. The Black Belt certification requirements are a little bit more stringent. Not only must you complete the intensive online bootcamp certification training, and not only must you successfully complete the Black Belt certification exam, you will also deep dive into the 5 stages of the DMAIC methodology. So we've got some deep dive assignments built in there for you, but there is a certification project required. And so not only do you acquire the knowledge, but you actually apply the knowledge as a black belt to generate results. And you can put that in your portfolio of value, then share it at work. And also, if you move on to bigger and better things. Upon successful completion of the program, each candidate will become a certified expert in Lean Six Sigma methods. Each recipient will also receive continuing education units. Now, the CEUs that we award are nationally recognized units, and they're designed to provide a record of your continuing education accomplishments. If you're a green belt and you wanted to complete the program as quickly as possible so you can achieve your new qualification, this is the 5-week sprint to certification. You go through 10 units and 42 lessons of Lean Six Sigma training. Every week, you lockstep through a program of study that's designed for you, and we give that to you in your syllabus and in your program of study. At the end of each week, it's optional for you to attend anywhere from a 2 to 4 hour sessions that's live with our Master Black Belt online in this type of environment. At the end of week number 3, you've got 2 weeks to sit for the exam. Once you complete the exam, you've met the minimum requirements for Green Belt certification. Now, if you choose to have a Lean Six Sigma project on top of that, and that's optional for green belts, then of course you can do that after the certification exam. For black belt certification, it's double that. It's a 10-week sprint. You'll go through 17 units and 70 lessons. Okay, you follow the same format. There's a structured lockstep program that you go through, but at the end of week number 2, you initiate your black belt project. Then you continue going through the lockstep program of study each week. And then at the end of week number 6 to week number 8, you get to sit for the exam. And so in week 8, once you sit for the exam, you've got about another 2 to 4 weeks to complete your project. And so literally you're looking at about maybe a 10-week sprint to your black belt certification. Okay, let's go ahead and continue. Our product, our service is priced to be effective, convenient, and affordable. Okay, as you can see down in the lower right-hand corner, for green belt certification, it's $2,379, and for black belt certification, it's $4,379. But here's what you get for this. Number 1, you get a hard copy manual. You get your software for the Lean Six Sigma toolkit. If you're comfortable with Microsoft Excel, the statistical applications built in this program really makes everything very simple. Also for your tuition, you get online, on-demand multimedia instruction. Okay, that is both live and self-paced. We've added easy to learn multimedia tutorials on basic quantitative analysis, business statistics. Also involved is a library of templates and real-world case studies. So it really brings the program alive, and you can take the templates and put them in your own library and take them with you throughout the remainder of your career. And then, of course, we offer free Master Black Belt certification project coaching. Now, just a little bit of a price comparison. In the middle column, what we have is, pretty much a comparable industry competitor. For the right column, what we've got is, our black belt program of study. For the comparable industry competitor, let's say if you're going to go to a university program or if you go to another competitor, they typically say that your prerequisite for black belt certification is a green belt certification. For our program, we take you fresh. No green belt prerequisite is required. Secondly, there's the Minitab statistical software that you will have to pay for. With our program, the software application is QI Macros. It's the Microsoft Excel add-in, and it's built into our pricing. Okay. And then, of course, there's the online black belt certification program. And what you see right there in the middle column is pretty much kind of like the median price for the online black belt certification program. And then you see our pricing right there to the right. And then, of course, you've got the hard copy manual. It's pretty much around $79 in addition to what you pay for your tuition and expenses. In our program, it's all included. So when you add it all up, our program is the most affordable. We think it's the most convenient, and we think you get the most value for your tuition dollar. Just a little bit about our learning management system. We use the Moodle online learning management system. It's the most popular learning management system in consulting firms and universities around the world. Over 22 million students, and there's over 50,000 Moodle sites in over 195 countries. We think it's really kind of like the industry standard, and we make it such that it's really simple and easy to use. We amend it with, of course, our Adobe Connect live learning management system, and of course, we also use Zoom, this environment, for the online live coaching. We're at the end of our discussion here, and if you have any additional questions, feel free to contact us directly. You can email us at info@helpingmakeithappen.com, or you can call us at the telephone number that you see right here on the screen. Thank you very much, and have a great day.